The feeling of being overwhelmed or unable to cope with mental and emotional pressure is stress. Stress is our body's response to pressure. Many different situations or life events can cause stress. Sometimes the stress response can be useful. It can help us push through fear or pain. However, too much stress can cause negative effects. Long term, this can affect our physical and mental health. As per the result of large-scale survey conducted across India in 2019, young adults between the age of 20 and 29 years of both genders were the most stressed in the country. The major cause of high-level stress among young people are peer pressure, pressure to succeed in academics or work, and irregular routine. 50% of Indian professionals have reported that an uncertain future is their topmost source of stress, as was revealed in a recently concluded survey by the Sevenfold, a boutique HR and well-being firm. Every year, the world celebrates International Stress Awareness Week from 1st to 5th November. The day encourages, or rather, the week encourages people to sit back, unwind, and embrace peace. Awareness about this becomes even more significant this year due to the tough times people across the world have gone through in the COVID-19 outbreak. We at Medicircle are conducting International Stress Awareness Week series, wherein we will be featuring experts in this field to understand and create more awareness about the effects of stress. Hello, I'm Aprajita Mehra, and today our guest for the talk is Dr. Dnyanda Despande. Dr. Dnyanda Despande is practicing consultant psychiatrist at Smart Neuropsychiatry Clinic, Deccan, Pune. She is a consultant at renowned Dinanath Mangeshkar Hospital and Pune Hospital and Research Center, Pune again. Her special interests are to explore critical, spiritual, and philosophical perspectives in psychiatry. She's a member of the Indian Psychiatric Society. She has been actively involved in initiatives to educate medical, psychological interns and trainees on the intersection of psychology and psychiatry. She is a member of American Association of Eating Disorders, working on psychological aspects of obesity in children and adolescents in India. It is our privilege to host you today, ma'am. Welcome to Medicircle, Dr. Dnyanda Deshpande. How are you?
I'm fine. Hello, Aparajita. Thank you.
All right, welcome again, ma'am. So let me just quickly rush to our first question, and which is, of course, that what is stress and what are the most common causes of stress that you face every day with your patients?
Okay, so I think previously in this sequence, you must have seen different definitions of stress. So, in simple terms, stress is a reaction given by physical, emotional reaction given by our body, brain to any kind of change. Let it be positive or negative, it's a reaction given by our body. So different neurochemicals are involved, different physical responses are involved, different behavioral changes are involved while giving response to the change. So that is stress. We commonly see, as I specialize in children and adolescents, so I commonly see children, adolescents, young adults coming with different types of symptoms related to, but the cause is related to stress. So the causes may be health related, like physical and mental illnesses, then relationship related. So in young adults, getting married, breakups, then relationship conflicts, even at workplace, in academics, at school level, at college level, then especially academic pressures. Nowadays, the online schooling, the sedentary habits, finance related issues in young adults, and of course, there are personal reasons also.
Right.
So I would like to, before this, we have seen different reasons for stress and different presentations of stress. But I would definitely like to emphasize on eating issues and obesity related to stress.
All right, that's really wonderful that you will be talking about that, of course, in our next few questions. So let me just first ask you, when should a person seek professional help to deal with their stress?
Definitely everybody has to go to the stress. Like it is, if we call it as it's a reaction to change, then change is what is permanent. So everybody has to face some or other kind of stress, so there won't be any life without stress actually. So if but when to seek a professional help or expert help for stress, there are some alarming signs, I would say. If one of the areas, one of the domains of your life is getting, or all of the domains are getting affected to some extent, right? Some relationship issues are recurring, work is getting affected, your finances are getting affected, either, or your physical or mental well-being health is getting affected in ways like emotional outbursts, mood swings, repeated conflicts, then you are facing some cognitive disturbances like lack of concentration, declining performance at work level. You are going through repeated avoidances, work related absenteeism, school absenteeism. So you should find and go back to whether there is any cause related to stress. Person might go into withdrawal, isolation, social isolation, or complete withdrawal. Person might use the strategies used by a person to deal with stress is called coping or are called coping strategies. So person might use some coping strategies, maladaptive behaviors like addictions, to deal with stressors like increasing alcohol, increasing tobacco consumption, or smoking. You're going through phases of insomnia, sleep disturbances, or some physical illnesses, chronic, especially if chronic stress get converted into physical illnesses like we commonly know hypertension, diabetes, metabolic syndrome like PCOS, and definitely obesity. So if you are facing such symptoms, simple physical reactions like hyperacidity, repeated headaches, muscle aches, and pains can be also symptoms related to stress. So if you are going through any of such disturbances, it is recurring, then this is high time you should seek an expert help.
All right, that gives actual some clarity into when exactly a person should be alarmed that they need to seek some professional help. Now, what are the types of professional help which are available to deal with stress, doctor?
Yeah, from simple stress counseling to pharmacotherapy, there are multiple types of help. So I would just explain simple counseling like for a crisis management. This is a stress, this is a problem I'm going through. What should I do? Even this can be a single setting. Can take a person can take session therapy. Then a person can go for some supportive therapies, supportive counseling, a prolonged cognitive therapy, or rational emotive behavior therapy, mindfulness therapies, which will teach the coping strategies, which will suggest some behavioral changes by changing his thought and emotional behavioral patterns which are set over a period of time. And definitely, as I'm a doctor, I would definitely like to elaborate on some pharmacotherapy also. There are certain mental conditions which present either due to stress, or they are presented as a symptom of stress like anxiety, some mood disturbances, some acute stress reactions, or post-traumatic stress disorder. Such stress related conditions, they can be treated with simple psychiatric medications also. They are very simple. As we call it a stress, it's a time bound phenomena. So they might be for a short duration, but that definitely will help to cope with the stressors particularly.
All right, that opens up a lot of avenues for people to seek professional help, and they now have so many things in hand by which they can actually hope to get better soon and just not, wallow in, just whine around with their problem anymore. So now that we just noted that you have specialized in, for obesity in children. So are those coping mechanism of children to deal with stress that they are eating and in thereby getting, obese? So, doctor, could you just reflect something over that and try and explain how adolescents and children cope with stress and what should, we as parents should do if at all we see them doing that?
Not only adolescents and children, even adults do the same, because it is a very uh, innate, or I would say it's a very long back response of a brain to deal with stressor. For I would say the man who was evolving, stress was hunger, or means there is some fear, there is some disaster, natural disaster he is going through. So that is how a stress would present for that man 4 lakh year old. So the brain of
So true.
today's human is also the same 4 lakh
In
year
fact, I
old
would give
brain.
my own example. Every time I'm depressed or in tension, I hog up ice cream. And I tend to take on so much sugar if at all I'm in any which manner stressed. So that is such a
Like,
normal thing to do.
yes, so because it is like the signals were, there won't be enough food, there won't be enough energy to deal with stress, there won't be enough. So then what to do is store. So those then store food, then store energy, then
Gluttony.
consume lot of things. So
Yes.
store in body as well.
And
So that was
actually,
a
essentially, what is going inside is that you feel that emptiness you're trying to, cover up with that food.
filled with
Yeah,
things.
that
Yes.
feeling of
So,
emptiness.
and it is very much related to our brain chemicals and hormones also. So the stress hormone getting released in body called cortisol, it actually converts everything into fat, because that is how our body is wired, our brain is wired to store in times of stress. And that is a response. We know eating, as you told your example, stress eating is very common. So at times of stress we feel like eating fatty, salty and sugary food, because these are the basic elements we require to produce energy. So, and that's the calories get accumulated and it gets definitely converted into fat, obesity. So these are the same presenting complaints, where actually the person presents with some complications of obesity, like hormonal disturbances or metabolic syndrome, girls presenting with PCOS, and mood disturbances related to that. Then if we go back to the causes, somewhere around 2 3 years back, few years back, the child, the adult has adopted the mechanism of whenever he is stressed, eating, whenever he is stressed, eating. So that start getting it converted into obesity. So eating disorders have a common cause of common means cause of stress related to it, one of the causes.
So that my second part of the question was कि if at all parents observe this happening, so like for us to like we are adults, we are educated, we are aware of a lot of things. So after a while, even when I do binge eat, of course I know how to restore myself back, and just I naturally know when to stop. But with kids, it gets a little difficult. So what I wanted to know, doctor, was what does a parent should do, like if at all their kids are doing this?
They should actually start looking for the causes of such emotional eating. So is it anything related to the sedentary habit the child has developed, the stress he is going through because of peer pressure, because of any academic difficulties, because of multiple reasons nowadays children and adolescents go through because of this online education and means untimely exposure to many things. So is it related to that? If they find any such thing, they should take help of a expert psychologist, psychiatrist, counselor, mental health professional. And secondly also, somewhere every family should start addressing that eating is for eating and not for emotional reasons.
Right.
So that
So
is
so
how
correct.
that we should start disconnecting emotions from eating. Of course that cannot be done altogether, it's not not physiological, but at certain point we should not take out stress on eating.
Right. And now I'll have this always in my mind before I do that, because naturally I'll be posing as a very bad role model if at all in the family if I do that again. So thank you, doctor, for just correcting me here and now. Let me just quickly move to our last question, which is what are the lifestyle habits that we adults or children, as adolescents everywhere, can adopt so that they can help that can help reduce stress?
Um, Definitely. Actually, this is not a short question to answer. The answer will be quite elaborate because we are
I understand that,
talking
but a
about
few
life.
tips, a
Yes,
few
of course.
lifestyle changes, of course.
Yeah, life, because we are talking about lifestyle here. So life consists of many parts, domains. So I would talk about, maybe let us talk about physical domain first. What are the habits we can adopt in our daily routine and stay consistent on them to deal with stress, to cope with stress, and if it comes, how to, or if it comes to that level of prevention of stress. So exercise, regular physical activity, diet changes, eating healthy food, and some omega-3 fatty acid containing foodstuffs, some chocolate like substances which are actually means they have endocannabinoids, endorphins in them, which boost our coping and happiness hormones. Then some fish, high quality proteins, meat, these substance, nuts and substances, basically healthy diet. uh, so
Right,
exercise, healthy diet, then meditation or yoga practices which relax us. So these are physical changes we can do. Some behavioral changes we can do by increasing our socialization, actually increasing our sources of happiness basically. If chances of socialization, having healthy family relationships, social relationships, having a good relation at your workplace, so that will be a sharing, venting buddies with us to deal with stresses. Then
right,
yeah, then certain, uh, we definitely have to work on our thinking patterns also. So taking help of an experts for developing, or maybe you can take help of some self-help books. Some, there are lot of material available on internet now for developing certain types of thinking patterns, cognitive behavior strategies, some rational emotive behavior strategies, which actually teach us how to think in better ways. So we should not actually delete all these techniques when these are for only clinical people and not for us. By saying this, we shouldn't do that. So by developing healthy thinking habits, we can actually learn to deal with stress.
right. So true. So thank you so much for coming on our show, Doctor. You have been so helpful, so insightful, and you have given such basic guidelines to live life by. And I think ideally everybody who listening would be listening to our interview today through Medicircle would of course be learning so much from you. So thank you again from everyone here at Medicircle. It was a pleasure hosting you today, ma'am. Thank you.
Yeah,
Thanks a
it was
lot.
pleasure to talk with you, Uptajita. Thank you.